Hello, everyone. I'm just going to keep the video on for a moment to say thank you so much for your interest in hearing from me today. As I understood it through my dialogue with Peggy, we're going to cover off a little bit about, well, what is a seniors advocate? What does our office do? What's my role? What are some of the things our office has been doing? And some of the areas where we're headed towards. Okay. So, the Seniors Advocate Act is what actually establishes the role of the Seniors Advocate in Newfoundland and Labrador, and my office, the Seniors Advocate Office, Newfoundland and Labrador. And so the Act, which was proclaimed in 2017, really outlines three specific things that I'm responsible for, and it's very much tied to systemic advocacy. So we as an office and myself as the advocate do not have authority to do individual advocacy, but we work on systemic issues, so things that are important to a number of seniors and impact a number of seniors. We can identify these issues, we can review them and analyze them. That's all part of my responsibility. In addition to that, we can work with organizations, community organizations, professional organizations, associations, government, etc., to really dig into, well, what are these systemic issues? What's the issue here? What's the best resolution to resolve it? And if we come to a place that, okay, we need to make recommendations to government to make significant change to resolve it, then I have the authority to make recommendations to government organizations, even to community organizations. It's a fairly broad responsibility. So just in terms of the powers and duties, it really, the Act outlines very specifically in Section 16 what it is that I can do. And I think we really highlighted it in the last slide. This is more in detail. And what I'll say to you about it is that oftentimes the advocate is in the position whereby my office receives upward of 80 calls a month, sometimes over 100, from individual people, whether it be a senior or often it's a family member of a senior, expressing a concern about an individual matter. And what we'll do is we'll do our best to refer that person to a location that can help them, whether that be a community organization, it could be a regional health authority, wherever. We'll try to hook them up with those services, because we can't individually advocate, nor do I have the resources to do so. We're an office of 4 people, myself as the advocate, 2 advocacy consultants, and a clerical position. So we really don't have the resources here either, and I don't have the legislative authority or mandate to do individual advocacy, but we'll take those issues and we'll roll them up. And so the hundreds and hundreds of calls over a year we roll all that up, and we determine, after 6, 8, 12 months, maybe a year, we'll look at it and go, we're receiving a lot of calls or emails or letters related to this matter. And then that's whereby I can then use my powers and duties to look at reviewing that matter, consulting with whomever it is that I feel is necessary. I have authority in the legislation to seek documents from whomever, government organizations, community agencies, etc., to help inform my analysis, and then again make recommendations. The other piece outside of all of that is I also have a responsibility around informing the public about matters that are important to seniors, so systemic issues, making the seniors aware of the office and what we're doing, but as well related to issues related to them. So one that we've kind of taken a bit of a role on most recently has been around abuse of seniors, and specifically financial abuse. So one of the things that people say, well, how do you define senior? And I don't need to tell you folks how different the needs of seniors are depending on their age group, and of course, even within the age group. The legislation defines a senior as 65 plus, which is a quarter of this province, and we'll get into that in a moment, or just almost a quarter of the province. But it also says we can work with individuals in matters related to seniors who are less than 65 if they're receiving a senior service. And senior service is defined in the regulations. It's very broad. It's a service related to housing, income, health. It's so broad that, to be honest with you, almost anyone will fit in there. So for us, we really say that our office deals with primarily people 50 up. And so, which is 47.1% of the province. So almost half the province would qualify for intervention and involvement related to our office. And of course, again, it's meant to be related to systemic issues. And so I'm sure many of you would know, but systemic means things that are impacting a large number of seniors. So accountability is really important to me and to our office. And so how do we ensure, and how do I ensure that I'm accountable to my client, who is obviously the seniors of this province? And so I'll just give you a little bit of background. I came into this position in June of 2022. Prior to that, the position had been left vacant for a year. I think there was a lot of surmising around whether the position would be filled. And prior to that, there had only been one advocate. Dr. Suzanne Brake, had opened the office in 2017 when the legislation was proclaimed, and she stayed until she retired back in 2021. So again, then it was vacant for a year, and I felt it important that the position be filled and that it have a presence, because in my previous role, having a responsibility around seniors and aging, it is really unfortunate that often seniors feel they don't have a voice. Families are frustrated. I just really felt, if we will all have the privilege to grow old, God willing. And so I just felt it was really important to take on this role. And so coming into this job, then I felt, okay, well, there is an accountability here to seniors, and how are we going to make that happen? And, often there's a digital divide with seniors. They're not on social media and those kind of things. So how do we make sure that we're out there, the seniors are hearing from us, that we're hearing from seniors? And so some of the ways around this accountability is, well, in the first instance, I'm an independent statutory office, and I'm an independent statutory officer of the House of Assembly. So I don't report to government. I don't report to a minister of government. I report directly to the Speaker of the House of Assembly. And so I'm independent in that. And if there's other sections in the legislation that I talked to you about that, and even in what I showed you, that shows I not only have a responsibility, but I'm accountable to be advocating on behalf of seniors related to systemic issues. So, I say to seniors when I meet with them, I always say, not only is it my job, but I said, I'm legislated to do this. And so, it's quite a privilege after 32 years of being inside of government to be in this position, to be able to speak publicly. But it's also a huge responsibility that I don't take lightly. The other piece around accountability is recommendations. So the legislation enables me to make recommendations to government. And so am I making those recommendations? So back in 2019, this office did release a report entitled Long May Your Big Jib Draw. And in that report, there were numerous recommendations. And the following year, they released a report related to older workers in the workforce. And so then we hit COVID, and then, of course, the office was vacant for a year. So for me, coming into this position, it's been really important for me to get out there and determine where is government at in terms of meeting the recommendations this office has made to date. And so back in the late fall, I did release a report, which was status of the recommendations. And I've also said publicly and to the ministers involved that we'll be releasing that on an annual basis. So we will continue to release annually every recommendation we make. What's the status of it? Has it been implemented? And if it hasn't, where is it? And so that's an accountability piece for me in my office. And of course, the reports is another piece that I just talked about. So putting out information so that people can determine are the needs of seniors that I've recognized been met? Had they not been met? And am I doing my work to ensure that they are being met? That I see that as a role for me. The other piece is around public engagement. So when I came into the position on June 15th, on June 16th, and this is related to the media presence as well, I called together the media to do basically a reach out to all seniors in the province to say, I'm here, here's what I'm planning to do, and you're going to tell me if I'm doing what you want me to do. And so we started a public engagement process whereby we had 15 communities we visited, 2 online sessions, and an online survey. The online survey we made available through mail, or if people wanted to call the office, we'd fill it out for them. And so pleased to say we had almost 400 seniors come out to public engagement sessions, and we had over 1,000 people respond to the online survey. Unheard of, I have to tell you. The statistics people tell me that's remarkable. It's actually statistically significant in terms of the response and generalization to the seniors in the province. And so a little over 900 of the almost 1,300 responses were seniors themselves. Some were seniors like family members or caregivers, and others were service providers, but those numbers were smaller. So these are all ways that we and I specifically try to be as accountable to seniors in this province as I possibly can. And of course, Paddy Daly, I laugh, but Paddy Daly, VOCM has now become a regular for me, ensuring that, because seniors listen to it, they have it on lots of times all day long. And so it's an opportunity for me to be able to let them know what I'm doing and respond to their concerns. Okay, so a little bit about the demographics of the province, which many of you I'm sure will know. So right now, today, if you just focus on 65 plus age group that I said my office is specifically responsible for representing, that's 23.6% of the province. And I don't need to tell you folks, I'm sure you all know that over the next 10 years, that number's going to 29, and then in 10 years, and then in 20 years, it'll be 30%. Much of this is tied to the fact that we have an aging population, because we have baby boomers, that large group of baby boomers who are aging through the system. And so, it is a large number of people in the province. If you move that forward to looking at, as I said, our office often is 50 plus. So this slide shows the 50 plus. 50 plus, we're at 47.1% of the province today, 49% in 10 years, and then it'll start to drop off a little bit because, of course, the baby boomers would have moved through the system, starting to move through. This has such remarkable impact in terms of when I meet with seniors, I say to them, look, you think you don't have a voice. You are the voice. And if you think about who votes in this province, I'll say to them, you are the ones who vote. So don't underestimate the power that you have as a group. And the flip of it, though, is it means as a province, we should have already, but we are later in the game, I think, than we should have been. But here we are, planning for an aging population in a big way. And so as a consequence, we're all now scrambling to ensure that, we start to plan for the needs of an older population. And I'm sure many of you are living that day in, day out, working in the health system for sure. So I'll tell you a little bit about our public engagement process. So as I said, we had 15 in-person sessions and 2 virtual online. We opened it up to seniors, family members, service providers, and we visited every region of the province. What I can tell you is, I believe there was a view that seniors didn't, they wouldn't be as engaged. They don't maybe, care that much, or, they're not that type, of group. I can absolutely tell you that myth is dispelled. They are so engaged. They are so concerned. They want a voice, and they want someone to represent them. And I think it's very much tied to what we're getting back in our surveys, which is they're struggling. They're struggling financially in a huge way, and they're struggling from a health perspective. So we'll go into that a little bit. So in the public engagement process, we focused on 4 key areas. And that is day 2 in the job, what I said publicly. I'm going to focus on these 4 areas. And so in these sessions, we focused on 4 areas, as did the survey. But I always said, we'll leave time at the end if there's other things that are important to you. And so the 4 areas we focused on were healthcare, transportation, cost of living, and healthcare, transportation, cost of living. Now I've lost the 4th one. We'll get into it as we move forward. So healthcare. So from a healthcare perspective, here's what I'll tell you. So what the slides you're going to look at now, or the next 4 slides, are tied to, here's what we've heard through our consultation process. Through our survey, we are still in the analysis phase. We don't have the final report back, but we have a draft we're working through. And so we will be releasing a what we heard document for sure in March at the latest, by the end of March at the latest. And that document will outline specifically what we heard and whereby there was any statistical significance between regions, we'll note it. And so what I'm giving you here is kind of some of what our understanding is from that survey without having the final. So it's still a little bit high level. Okay, so from a healthcare perspective, what I can tell you is every time we went into these sessions, healthcare was housing was the 4th area, I'm sorry. So healthcare was always the one that took the most time. And we'd be an hour into it and I'd say, folks, we really got to move on because we've got 3 more to cover. I mean, healthcare has been so significant. I cannot tell you. I'm sure I don't need to. I'm sure you're living it every day, you know. What is interesting so far from a preliminary perspective in the surveys is that healthcare and cost of living are almost equally important from the people who responded. So, because you'll have to remember that 400 came out to the survey, to the in-person. And so what you're hearing here is primarily tied to healthcare being most important to those that came out to the in-person sessions. But when you got people online, they talked a lot about their financial needs. And I think that's indicative of people are embarrassed. I mean, it's embarrassing to talk about. I've lived my whole life. I've worked. I've raised my family. I did everything right, and now I'm struggling financially. I mean, it's a hard place to be, right? So I think it was easier to do that on a survey than it was to talk about it publicly. But anyway, so from a healthcare perspective, it was the area of most need, and primarily it was about needing access to a primary healthcare person. And it didn't have to be a GP. It did include the GP, definitely. It was when I asked the question, okay, so you're not able to get access to a primary healthcare person, you know, for your immediate needs. Is that your GP? Does it need to be your GP? And overwhelmingly it was no. I mean, we would be happy if we could, you know, have a nurse practitioner or a nurse, someone who can, you know, do that immediate need I have for today, if they have that skill set. And so, and I think that's indicative of, you know, when you think about seniors, many of them grew up with the public health nurse being the primary person in their community, and they were very open to it and actually welcomed the idea. The other areas, of course, were long-term care. And I mean, it was overwhelming, the messages around long-term care and personal care, both of them. It was horrendous. The stories were horrendous. I mean, it was so sad. Now, there were good stories too, don't get me wrong, there were. But overwhelmingly, it was more on the negative. And I mean, I'm sure that that's indicative often of, well, you know, it's like anything, right? People will come out when they have something they want to share that's, you know, that's concerning them, not always when they have something positive to share. But at the end of the day, it was so significant that back in 2019, my office had called for a review of the long-term care and personal care home systems, and the government had done nothing about that. And so I recalled for that. Back in the fall, I went out publicly and said, I can't keep listening to the stories. You know, we don't need to get to the end of this review. We knew back in 2019 those systems needed a review, and I'm asking for it to be done immediately. And I am pleased to say that the Department of Health has made a commitment to do so, both systems, which I think was important. And you know, and I think it's important for me to say to you folks, I had tried to be very clear that this review was not about. Because families were very clear with me, it wasn't about the problem with the people working in the system. The problem was with the system. And they were really clear about that. I mean, there's not enough people in the system, the oversight of the system, how it's being managed and run. And we know that the acuity level for these facilities has continued to go up and is intended to continue to go up, with the idea that more people will stay home longer. We'll see if that happens. It's only going to happen if supports are put in place. But anyway, so they really didn't, it wasn't about, individual, the social worker or the nurse, it was about the system overall, and the struggle that people were facing in it. And there was a recognition that it wasn't just a struggle for the family, it was a struggle for the people working in there too. So I was pleased, that it was balanced from that perspective. So I did call for a review. I called for a review with the idea that, and I laid out in the call, that this really needs to be about not how we fix the current system. It's about how we design the system of tomorrow that we need, knowing where we're headed from an aging population, knowing the acuity level is going to increase to go, that's intended. Then let's build what we need and then resource it as, plan for it. So it's not, I know it won't be a solution for today or tomorrow, but it could be a 4 or 5 year solution if we build a plan to work toward it. And so the department has recently come out and said they have an expert panel put together to begin that. And I'm very hopeful my office will be engaged in that. And I'm hopeful that the end of that piece of work will be a blueprint. We'll see. Okay, so then the other piece is, we're doing some work with the Department of Health around looking at things related to how do we meet the primary care needs of seniors. Cataracts. We know that the cataract ability to do cataracts through MCP in private clinics has started. We'd like to see more of that. We'd like to see maybe audiology be part of that. And my office has already called for driver's license medicals to be free for seniors. So that's some of the pieces. As well, just thinking, is there anything else there I want to highlight? Yes, we've also called for the shingles vaccine to be free. And I've recently, through a submission that my office has made to the budget process, I've called for the high dose vaccine to be available free of charge to people 65 and over who don't have health insurance. Whereas right now, I'm sure that it's only provided to those living in long-term care. So there's some of the things that the office is currently doing as it relates to healthcare. The second area we focused on was housing. And I always asked, as soon as I went into the room, I'd say, got to the area of housing, I'd say, okay, how many people in this room want to transpire in their own homes? So we'd have a little chuckle, and at least 95% of the hands would go up, right? Everybody, pretty much almost everyone, wanted to, remain in their own homes, and certainly until their final days. And so then we'd ask questions like, well, okay, I'm not surprised by that response. Tell me what you would need to continue to reside in their own home. And, it was really interesting. The response of seniors was such that it was dead air often. It was like, well, what do you mean? Like, we got our house, we just need to stay. And so then you'd start talking about, oh, okay, well, who mows your lawn and who's fixing your shingles and then that led into, oh yeah, no, I mean, it's a lot more than that, isn't it? And it's funny, when starting to look at some of the survey findings that I've got, the family members and the service providers very readily were able to identify all those things people would need to age at home and age in place. But even in the survey, seniors didn't necessarily identify what they would need. And I think it's tied to, they don't want to be moved out of their homes. So leave me alone. I'm happy enough. I'm going to be just fine. But we know that's not true. We know that's not true. We know we have to plan toward it. And we know it can't be fair for seniors to ask for what they need to be able to reside at home, or they're going to get unwell more quickly. So some of the things we're looking at as it relates to this is, we've got a fair bit of collaboration going on in the community and with municipalities. So every time I go out to community, I meet with municipalities and I'll say to them, what are you doing to support seniors in their own homes? What are you doing to ensure that they can stay home and still get out to get to groceries? And so things like, well, what transportation do you have in your community? Are you linking into government programs to get a transportation in your community? When you're spending any money here, are you thinking about making it age friendly, whatever you're building. So if you're putting in a walking trail, don't put it in the middle of a mountain, side of a hill. That's not going to work for seniors. Make it flat so that it's, the mom pushing the stroller, the person, with a wheelchair, or the senior with a cane, or just older and not able to do a slope, can all get good use of this. And I have to say, it's been really well received. And I actually had met with the Minister for Municipal and Provincial Affairs many months ago, and we had a good discussion about that. And most recently, they've put out last week a new grant for municipalities to access money to make their communities more age friendly. So I was very pleased to see that. Okay. Third area that we focused on was related to transportation. And I have to say, outside of St. John's, transportation for seniors almost doesn't exist. In terms of a formal, outside of family members or friends, there's very little transportation, is what we're being told. And I knew that from previous life, but there is some. And so we have been holding up things like the age-friendly community in Clarenville. I mean, they've got a community bus. I know Placentia does. I know there's some communities throughout the province that do, and we commend them. And they've actually agreed to be a resource to other communities. So as I'm going out, I'm saying to mayors, look, talk to these other communities. They've done it and they're making it work. And they got to have volunteers to run it, and there's a bit of work to it, but there is a way to do it. And so that in terms of transportation, the expense and affordability was something that we heard loud and clear. Like seniors were saying, to continue to drive a vehicle, pay my insurance and gas is really hard. And then if they, whether it was their own transportation or whether they had to use family or friends, the traveling conditions to get to, especially medical, was so, oftentimes it's so far and costly, and then, road conditions and this province, weather conditions, all of that, they found a real impediment, and therefore difficult to ask others to do, to give them a hand sometimes. So, we know the whole business of being able to reside in your own home and be well is tied to being able to get out in your community, but as well to access services. And so we know that transportation has to be part of the answer. And so, as I said, we called for, we're leaning hard on the whole business of extending the age-friendly transportation program, which is the program that Department of Children, Senior Social Development has. It's $300,000 a year grant. It's nowhere near what it needs to be, but where we've been moving in the direction of how do you government, if you want people to continue to reside at home, then you really need to think about how you're going to make transportation accessible in communities. The other is, many of you would know that there's a MTAP program, Medical Transportation Assistance Program in the province, and it is under review. Our office called for a review of that back in 2019, and Department of Health Community Services agreed to do the review, but has not been completed. And so we are, calling for that to be completed. But in our most recent submission to the budget review, we actually made specific recommendations around changes to, at least in the interim of getting the review finished, make it such that it, give families some level of assistance, because right now it's just not meeting the mark, and especially for families in Labrador. And as I think I said earlier, we asked for the driver's medical to be free, and I understand that is under serious review. The other thing is that I recently met, so there are 3 seniors advocates in the country, only 3. And so we're progressive in that regard as a province, that we have one. So does New Brunswick, and so does British Columbia. And we recently met as a group in Ottawa, and I met with the Federal Minister for Seniors, Minister Cara, and talked about, it was good that there was an extension to the OAS recently, 75 plus last year received a 10% increase, but hopeful to see that move down to seniors 65 plus. And she did commit that they are looking at the GIS and the amount that pays. So even that would be a benefit to seniors. That will move us, I'm looking at the time, that will move us into the cost of living, which was the fourth area that we addressed when we met. And, I have to tell you honestly that I really do believe it's a misconception that seniors in this province are doing okay financially in relation to other age groups. I'm not saying they're well off. I'm just saying that when departments of government specifically tied to, for example, the basic income that's being discussed, the idea of having a basic income in this province, there really was a vision that, well, seniors were doing okay because they've got the GIS, they've got the OAS, they might have CPP as well. There's the senior supplement. So they're doing okay, right? They're above the poverty line, no worries. What I can honestly tell you is they are not. They are not. The average pension, if you want to think about even seniors who actually have a pension, the average government pension in this province is $24,000 a year. 24. I was shocked. But I think it's tied to the fact that these people retired 30 years ago when salaries were so low, and of course it hasn't been indexed. Then if you don't have a pension and you're only relying on these federal income opportunities, truthfully, because the lack of indexing, it hasn't kept pace with inflation, and we are in a place now that financially seniors are just above the poverty line. So when we did a review of this with the Department of Children, Senior Social Development, what was determined is, they kind of looked at that because we were challenging it a little bit, and what they determined was it's the seniors who are just above. They're a big group that's just sitting above it. And now lay on top of that the increased cost of living that we're all facing today. They're not making ends meet. And as I said, when I was really surprised when we got the survey results to find that it's almost equal what seniors are saying in terms of the needs they have around healthcare and the needs they have around income and their struggles. So as I said, to kind of try to start looking at some of this, we were part of meeting with the Department of Children, Senior Social Development and informing their views around a basic income approach so that seniors would be involved. We have made a submission to the budget process. We've also, as I said, spoken with the federal minister. And of course, we're big on collaboration with community. And, I know there's others out there who are doing great work in the community. And so how we've been linking into some of those things to ensure that seniors perspective is brought to the table. So the picture you're seeing here is when I met with there was a collaboration around rethinking food charity and of course, the whole poverty piece around food banks, etc. And so, so that is a piece of work that we've been doing. So just from a next steps perspective, because, I've kind of gone into depth around areas we've focused and work we've been moving forward and things we're doing. But I also want to tell you that, we're going to be taking the analysis from the engagement process that I talked to you about. You will see a What We Heard document released next month. And then from that, we'll make recommendations to government, probably in the fall, because part of the work in between releasing the What We Heard and making the recommendations is really needing to dig into the data and the research and best practice and what are potential solutions to some of these issues and ensuring that they're good measurable recommendations when they're made so we can measure them after the fact to see are they being met, and ensuring that A, they meet the mark for seniors, and B, that they are achievable. And tied to that, of course, will be continued public awareness around seniors issues and advocacy. So other than that, what I haven't talked to you about, and I'm not going to go into detail on any of this because we don't have time, there's a whole lot of other things that this office does. So, we've been working hard around the Health Accord implementation, to meet with the team inside of government who are moving forward on those recommendations to inform our perspective around the seniors' recommendations inside of that. The age-friendly communities and business approach, pushing that as an idea in the province. And as I said, really happy that the Municipal Affairs Department took it up. Addressing ageism. I'm on a national committee around ageism. It's a huge issue. It's a huge issue in the health system that the health court clearly talked about that we need to get inside of. Aging in place, I've talked about, I won't go into. Older workers have a partnership with the Board of Trade and Senior Workers NL. Older workers, the survey done by the Board of Trade, 74,000 seniors in this province would like to either be working or continue working. Now, reason being they want to be challenged, reason being financially they need the money. There's a whole lot of reasons, but at the end of the day, it's a massive workforce that is available. And I think the workforce has the employers have to change in terms of accepting that group in and figure out how they meet their needs. And of course, Indigenous elders. So we've been approached by Indigenous organizations to say, really like to have our voice out there as well separately. So that's something you'll see us do in the very near future. So we're on social media. If you would like to follow us, we're on Facebook, Seniors Advocate NL. We're on Twitter, and we also have a newsletter. So that's another piece around accountability. When I started in the job, I said, how are we going to get things out to seniors? How are they going to know about us? And lots of seniors are on email. So we have, I think we're at over 300 now seniors signed up to receive emails from us, and we'll communicate with them around things that are happening in our office. If there's news out there in terms of programs or services we think would be useful to them, we email it out to them. I always get these lovely emails back. It's so lovely, thanking us for the work. It's so nice. So, and this is our contact information. It seems how this will go live. I won't bother to run through it, but basically these are all the ways you can reach out to our office at any given time.